Morning, everyone. My name is Richard Scone-James, and welcome to our application webinar on the Global Capacity Building Programme. We're really delighted to be talking through this with you today. I'm joined today by two of my colleagues, Dr. Shiba and Maleba. If they could introduce themselves. Shiba, would you like to go first?
Thank you very much, Richard. Good morning, everyone. Pleasure to see you all. My name is Dr. Shiba Jita. I'm the country director for Uganda. I'm based in Kampala and looking forward to a very interactive session. Back to you, Richard.
Thank you, Shiba. And Maleba, over to you.
All right. Good morning, everyone. My name is Mleva Matafwali. I'm the country director for the THET Zambia office, and happy to meet you all in this meeting. Thank you.
Thanks so much, Maleba. And sorry, I should have given my background as well. My name is Richard. I'm Director of Programs at THET and overseeing this program. So we've got about hopefully half an hour, 35 minutes of slides to run through the application process and the application form. And then we'll have time at the end for any questions. So do as we speak, jot down any questions, put them in the chat, or at the end you can raise your hand and we'll take questions then. Obviously, we're very happy to continue taking questions after the call as well. We have a grants@thet.org email address you can use for that. So we've covered today's panel. Thank you, guys. So just a little bit of intro on THET in case you're not aware of us. So we're the Tropical Health and Education Trust. We're a global health NGO, mainly supporting the capacity development of health workers in Africa and Asia. And we do this through the health partnership approach. We were founded by Professor Sir Eldred Parry over 30 years ago now. And we have over the last 12, 13 years now, through our health partnerships, trained over 100,000 health workers and worked on various curricula and policies across the world. The model of health partnerships is, I'm sure, familiar to a lot of you on this call, but it's a model of linking UK health institutions with institutions overseas, and the two institutions improve health services together by sharing knowledge and carrying out capacity development activities. We see these health partnerships as long-term, so beyond just a grant project, sustainable and mutually beneficial. So we see UK health institutions getting involved, benefiting from bidirectional learning through this type of engagement. Partners generally co-develop programs together. They would then submit an application for grant funding from THET, and then we provide the funding, sign the contract, and partnerships deliver the work. This work usually addresses organizational priorities at the overseas health institution, but also feeds into national level priorities as well. And if you're not familiar with the health partnership model, we have a huge amount of resources on our website as to how to set up a health partnership. And we've linked to this in the call document. This is one example. You can see from the contact section here, kind of the different areas that it covers. So yeah, very useful information. So to this program, Global Capacity Building, or GCB for short, we're really delighted that NHS England are funding the program, and many thanks to them for their ongoing support in this area. The program aims to facilitate the sharing of knowledge, skills, and experiences through health partnerships between NHS institutions in England and health organizations in South Africa, Uganda, and Zambia. As we said in the call documents and on the website, we're not quite ready to launch the call for South Africa just yet because we're still identifying the priorities, but we're moving ahead with Uganda and Zambia. So information on South Africa will, we hope, come in the next few weeks or so, but I can't put a date on that for now, unfortunately. Just to be very clear on the overall grants setup. So we will be awarding 10 large grants of up to £50,000 across the 3 countries. So that's 10 grants in total. How they're split across each country really depends on the number and quality of applications we get through. So we'll see. We are also going to launch a call for small grants of up to £10,000 next month, and we're anticipating that this will not necessarily directly feed into those national priorities that we've outlined in the scoping report, but maybe a wider scope there. And I've put the timelines here, but I hope they're fairly self-explanatory. 18-month grant implementation phase, the main takeaway from that. In terms of the core requirements, again, throughout these slides, I'm not going to repeat every word that's in the call document, but just pick out kind of things that may need further explanation or things that are particularly critical to understand. So every application has to come from a health partnership, which involves 2 lead partners as a minimum. 1 lead partner must be a health institution in England, and 1 lead partner must be a health institution in either Uganda or Zambia. And we set out the eligibility criteria for those institutions below. Because this is funded by NHS England, one of the key outcomes from the project is that volunteers, NHS staff who work in England, are involved directly and benefit from their involvement in this program. So at the core of any project that you design must be at least 1, hopefully more, NHS staff who volunteer their time to deliver capacity development activities based in England, essentially, is what those kind of 3 later bullet points are trying to get at. And of course, the application must contribute to the priorities that are set out in each country's scoping report, which is on the website and which Mleba and Sheba will talk through shortly. So in terms of that scoping report, we a number of THET staff carried out scoping assessments in Uganda and Zambia in June, I think it was June or July, in order to identify the health system priorities that this program could address. So the THET team explored the current status and challenges within the health system, how effectively population needs are being met, and how in particular a health partnership model with UK expertise could respond to that. And we also looked at what existing health partnership footprint there was in each country. And so the teams led a number of key informant interviews and focus group discussions with Ministry of Health officials in each country, with the UK FCDO, with other NGOs to really identify where can THET and this program play a role and where can we not duplicate. So following that assessment, we wrote up the scoping reports, which you can see on the website. And I think we are now going to go to Sheba and Mleba to just talk through those priorities in a little bit more detail. So Sheba, can I pass over to you first of all? Thank you.
Okay. Thank you very much. So as Richard has just explained, we had a rapid scoping visit in Uganda where we spoke to the FCDO and the Ministry of Health leadership. We went through a couple of national priorities, and for Uganda, we were privileged for the ministry to share with us some of the priorities that had been identified during the joint mission review for the year. And out of those, based on the funding available and the nature of project, we zeroed down on these 2 key priority areas. The first being increasing access to quality maternal and neonatal care. And the second one being improved health leadership and governance at local government level. So these are shared priorities from both the Ministry of Health view as well as the in-country FCDO office. And under increasing access to quality maternal and neonatal care, this is against the backdrop of the country trying to catch up and address the poor maternal and newborn indicators. So one of the key priorities under this is specialist training at referral hospitals and centers of excellence. We are looking at neonatologists, obstetricians, nurses, and midwives. And the priority sites are Kawempe Referral Hospital, which is based in Kampala, and Hoima Regional Referral Hospital in Western Uganda. And again, these were based on the numbers. Hoima has been picked out as having a lot of maternal deaths and neonatal deaths. And then the other area is regional orientations for nurses and midwives, again in the area of providing neonatal care. And we are looking at the catchment areas of Kawempe Hospital and Hoima Referral Hospitals, as well as any other areas that register high maternal and neonatal deaths within Uganda. So that's it with increasing access to quality maternal and neonatal care. The second priority, the specifics under that, is developing a leadership management and planning manual for subnational health managers. And one of the areas that needs to be tackled is behavior change around morals in a bid of improving health leadership and governance at the local government level. And the second is to pilot the in-service training in leadership and management for local government health managers. So the Ministry of Health has developed this in-service training. So is to work with them in piloting it, completing it and piloting it out. Thank you very much. Over to you, Richard.
Thanks so much, Sheba. That's very helpful. And yes, if you do have questions, Sheba, yeah, very happy to take those at the end of the presentation. But for now, we'll move on to Maleba to talk about the priorities in Zambia. Over to you, Maleba.
All right. Thank you, Richard. So equally as Sheba has shared, in June and July, we held a number of stakeholder meetings with Ministry of Health as well as FCDO country office, just to introduce the program and then to discuss the priority areas where this program can best add value to what we are trying to do as a country. And through these engagements, 2 priority areas stood out. And these are the priority areas that have been shared with the team in the UK and as projected on the screen. So the first area that was highly identified as a need is strengthening capacity in safe anesthesia service delivery. So in discussions with the team at Ministry of Health that are leading this work, including the Director of Quality Care Services within the Ministry of Health in Zambia, this area stood out as the #1 priority for us. And under this, a number of priority areas, specific activities were identified. As Richard has shared, if you look at the in-depth report, it highlights further. But what I will talk about in this meeting is just briefly capacity strengthening, quality improvement, and the development of a robust national standardized system where safe anesthesia is concerned, as well as quality improvement in safe anesthesia delivery in the provision of electroconvulsive therapy. And this, the Ministry of Health actually related it to mental health. It's priority, and it's an area where the Ministry of Health would want to to implement as soon as yesterday. And also in the process of just building capacity in the country in this field, face-to-face and virtual mentoring sessions were identified as an area that investment would be needed. And this would involve all anesthesia service providers across the country in public health institutions, where if possible, we can do face-to-face, and in some instances, we can hold virtual sessions. Curriculum development also remains as a priority, and this would lead to developing a bachelor's degree in operating theater nursing. As a country, this is a real need. And also, lastly, on this one, it's capacity building around facility and service quality assessment in facilities. And in talking about this, the ministry identified areas related to safety issues, equipment, infrastructure, and reporting and data reporting in the public health facilities. So that is a summary around strengthening capacity in safe anesthesia service delivery. Another area which the ministry identified, and that is the nutrition department within the Ministry of Health, is capacity building around integrated dietetics program in public health facilities. The ministry has a vision to really build capacity as a country in this field. The main theme around this would be strengthening nutrition competencies in managing malnutrition in public institutions and integrating NCDs in the training programs. Another activity which was identified in this is a training of competent clinical nutritionists, dietitians, and public health nutritionists. We have a number of training institutions in Zambia, public health training institutions that are providing nutrition and dietetics programs, but a need has been identified in building the capacity, developing of modules, developing of curriculum that currently doesn't exist. And key to this is really integrating NCDs in the training programs. Also the training of staff in providing therapeutic feeding across the country. And being a country which has 10 provinces, with each province having food that is unique to the people who live in these different areas, the Ministry of Health would really like to tackle the issue of therapeutic feeding as it relates to each region, each province. And so this is an area which they have identified that they will need support in. And lastly, it's technical support in national policy, training resources and tools to integrate nutrition and diabetes into, sorry, I can't see maybe you can just go up a bit.
Into the health system, I think it says.
Yes, into the health system. So basically, these are the two areas that have been identified by the Ministry of Health, and FCDO in country agreed that indeed, as a country, we need capacity to be built around these two priorities. I'll end here for now. Thank you.
Thanks so much, Maleva. And thanks to both of you. Hopefully that gives a little bit more flesh to the scoping assessment bones. And yeah, very happy to take questions later on the call on those priorities. But moving on with the call document just for now, you'll hopefully have seen that we have above and beyond those scoping priorities and the scope of the project work, we have encouraged applicants to consider integrating other project themes. It's not mandatory, but it's the kind of thing, if you are able to include one or two of these points in your application form, then you'll score extra marks. I won't go through each of these now. I think, again, it's fairly self-explanatory, but if you do have questions, do let us know. And I just wanted to pick out a few of the core selection criteria that we will be basing review of the grant applications on. And so I'd really encourage applicants to really think through having a clear goal that you are able to achieve with the funding. It's not a huge amount of funding, but it is something. What can you actually achieve with the resources and time you have available? We would much rather see a kind of conservative but well structured and well thought through application that looks deliverable than really inflated targets and trying to be too ambitious. So do be really careful with that. I will skip down to, as we've mentioned, the project should demonstrate clear benefit back to the NHS in England, and there are an enormous amount of resources available to support you to think through what this might look like. We have linked to the HE, the Health Education England toolkit on the in the form. It looks like this. There are lots of other pages. This is just one example, but it encourages you to think through some of the areas that a health worker in the NHS might benefit from when engaging this kind of work. But we're talking things around pedagogical skills, leadership, communication, project management, stakeholder engagement, all those kind of things. The next one I wanted to share with you, another toolkit, was on volunteer management. So if this is the 6th bullet point here. Obviously, involving NHS staff members, we do need to ensure that a duty of care is provided to volunteers. Earlier this year or the start of last year, THET produced a volunteer management toolkit, which I've showed the contents on the screen here. So if you're not familiar with recruiting and overseeing staff members engaging in global health activity, do take a look at this as you develop your proposal. It's got a few good ideas there. And we do want to see in the proposal some evidence that you've thought through how you will be managing volunteers. And then the final one I wanted to just flag with you is the last point on gender equality and social inclusion. We do take this very seriously. Again, we have a toolkit available on how to incorporate gender equality and social inclusion within your health partnership. And so here we're talking about the project delivery participants. So who is involved in delivering the project? How are they? Are there any barriers to their involvement in delivering the project? And then, of course, who is on the receiving end of the project? Who is participating on the other side? Are there barriers to their engagement as well? Have those been fully thought through? And this is a really helpful resource to help you think through some of the challenges that certain people might face in engaging in this type of work. There are a few budget caps that I just wanted to bring out. As we said, most of the capacity development activity will be ideally delivered by people volunteering their time on that 3rd bullet point there. But we will accept small trainer fees of up to 10% of the total grant budget where necessary. We have capped the project management and office overhead costs and M&E costs, but we do encourage you, please, to use that as much as you think is sensible. If I see a budget that doesn't have any project management costs, that's when I get really scared. So do please use those budget lines as you see fit. And then we have some areas that we are not able to fund. And just to clear up one point that often is raised, so we don't fund volunteer per diems, and by that we mean we definitely do fund the reimbursement of expenses, all expenses to volunteers who have engaged in this program. The partnership should be paying for their travel, for their accommodation, for their subsistence, any related costs. However, we refrain from giving a blanket per diem amount every day to a volunteer. Rather, it should be claimed back on exact transactions. And I just wanted to raise the reporting requirements as well. They vary throughout our programs that we fund. This particular program, I would say, is kind of medium intensive. So we are going to be requiring 6 monthly narrative reports through our online platform. And this looks at it asks the usual questions around progress of the project and challenges and lessons learnt. We'll also be asking for data on health workers and volunteers involved. And we would like that disaggregated by gender and cadre. But something new for this program is we're also asking partnerships to start to think about their impact on the environment. And our proxy for doing this for now is asking you to report on the greenhouse gas emission of any international flights taken. If you book through an agency, usually that number just pops up on the ticket. It could be that you just need to Google it and get the rough data there, but we're trying to capture the negative impacts of the work that we do as well. We do ask for 6 monthly financial reports with an itemized transaction list as well. So this means pretty much every transaction needs to be listed out with the date of purchase and the amount, so that is a little bit of work for the finance teams involved. And we do ask that all receipts and invoices are kept on file. We spot check a few of those receipts every 6 months. We don't ask to see all of them, but we do need you to be able to access them fairly quickly when we do request them. And then the other reporting requirement is a survey for the volunteers who take part that THET will create and share with health partnerships to then share on to their volunteers. And this talks through questions around the benefit back to the NHS. I've already shared this table, so let's keep going. So I just wanted to pick out a few bits of the application form. I won't go through the whole thing. Just to give a little bit more explanation if required. So history of the partnership and project implementation, question 2.4. We are inviting new partnerships to apply as well as existing partnerships to apply. So if you are new, please just describe in this box how the partnership met and how the kind of project idea was conceived, so that we know a little bit of background as to where this application is coming from. In terms of the justification, sometimes just to be really clear here, so question 3.1 is asking how the partnership assessed the need. What was the methodology? We're not asking for what the actual need is. That is what question 3.2 is for. So hopefully that's clear. 3.1 is around the methodology. 3.2 is around what the actual need is that you'll be working towards. And obviously we have provided the national need in the scoping report. So we're really looking at what further information you have from the institution where you're working to make sure that there's a really strong understanding of that need and then how that links to your project intervention. In terms of the project description, hopefully most of you will be familiar with this kind of table. It's a kind of a M&E plan, but also a project plan as well at the same time. But we're asking you to split out the changes that you wish to see by the end of the project in this first column here. These are not, we don't want to see your activities. That's for question 4.2. 4.1 is at output level, it's what are the short-term changes that your activities will lead to, and at outcome level, it's what do those short-term changes then lead to in terms of the longer-term change that you might have seen by the end of, or that you will have seen by the end of the project. And then 4.2 asks you to list out the activities. So as I mentioned before, we do really take GCB seriously. We of course want you to disaggregate data of health workers and volunteers by gender. But please, we need to see you go further than that in this box and really explain how you are doing more to encourage various different groups to access aspects of this project. And as I mentioned earlier, we are starting to have more of a focus on the impact of our work on the environment. This question 4.7 therefore tackles that, and we're looking at both whether you have plans to minimize the impact of the project on the environment. So that might be around, have you thought through the number of international flights you're taking, and or reduce the impact of the health system on the environment. So there's a lot of work going on in the NHS at the moment around minimizing the impact of the health system on the environment. Are there aspects within your project that can do the same whilst not kind of taking away from the core scope, which is part of the scoping reports? And I've spoken through this already, but so really what we'd like to see here is this is asking what benefits the volunteers and the NHS in England will gain from being involved in this programme. We know that you may well not have identified the volunteers yet. That's absolutely fine. But we just like some ideas and be as specific as possible as to how you think the volunteers and or the NHS institution may benefit from their engagement in the programme. And I think this is the last slide. So finally, on the budget, some people struggle a little bit with this template. So what we've asked for is a budget for the full 18 months, but we've asked you to split it out into those 4 columns of unit type, unit cost, quantity, and duration. And I've shared the start of an example here. I didn't fill out the whole thing, but for those who aren't familiar with budgets of this kind, the unit type describes what's in the unit cost, essentially. So if we take international transport, for example, we're saying that the unit cost of one flight for one person is £1,000. So that's really clear to us when we're reviewing the application, how you're measuring that. And then the quantity would be, there are 3 people traveling. So that's 3 there. And then the duration, let's say they're traveling 4 times across the course of the project. So we put 4 in there and that totals to £12,000. There is a notes column as well. So if you feel it needs further explanation, do just jot down some notes there as well. And you're very welcome and indeed encouraged to include extra lines within each of these categories. If you do so, please do make sure that the formulae on the right-hand side for the subtotal, that you drag that formulae down so that your the totals are not missing any of those additional lines. And yeah, so that's it. So the deadline for Uganda and Zambia applications is 13th of October, 5 o'clock UK time. And so what we need from you is the application form, the budget form, and a letter of support from both the lead partner institutions involved to show that they are, as an institution, supporting this application. And I should say, we would then go into we will then shortlist the applications and go into a due diligence phase for those who are on the shortlist. And so we will be getting back in touch with those applicants in late October, early November to carry out that due diligence assessment. But we then hope to make any final decisions on the grant funding towards the end of November. Great. Okay, so now we're going to, that's all our slides. We'll put those up on the website, but we've now got some time for questions. So do just put your hand up or write in the chat box and we'll try and get around to you. I'm just going to open up the chat now to see if we've got any queries there. So, well, let's start with, so Merlin has a few queries for Sheba and Maleba. I don't know, guys, if you've seen these questions in the chat box, but I can read them out for you. So, Sheba, so the question is, for Zambia, is the last priority to integrate nutrition and diabetes into the health system, or nutrition and dietetics? So maybe if you could come back to Merlin on that one, that would be great. And then in terms of queries on Uganda, so for Sheba, we have, can the money be used to pay for a master's course for staff in Uganda? Regarding the reimbursement of exact expenses, how is this possible when most local transport and food outlets in Uganda don't give receipts yet? I can respond to that one. And for Uganda, for the leadership management, is there a designated partner in Uganda? So Sheba and Labour, if you could come back to those scoping report queries, I'll just respond to the reimbursement of exact expenses. Yeah, we totally understand that often you can't get receipts from these places. So generally, we ask volunteers where that's not possible, or project participants, to sign to self-certify their own receipts, jot down the date and the payment amount, yeah, to capture that level of funding. Or certainly that's what we do in THET anyway, and that's enough for us. Sheba, you've unmuted. Do you want to come in on the Uganda questions?
Thank you very much. So thanks, Marlene, for your questions. Regarding the first one, whether the money can be used to pay for a master's course for staff in Uganda, I think that is outside the scope, because this is a short project. The master's courses are normally maybe 2 years, 3 years. And the level of funding, really, I think the area of interest for Uganda is, as we've said, it's around improving maternal and newborn health, specifically specialist training for those obstetricians and neonatologists, nurses, midwives. And so we are looking at more of support between a UK institution and an in-country partner. So if you're looking at a master's course, I'm not sure how that would fit within the health partnership model, because for this particular funding that we have, whatever activity has to be through this health partnership model. And again, the issue of value for money needs to come in, the number of people that are going to be trained, and the sustainability. So I don't think that this funding can be used to support a master's course, because that would probably be only 1 or 2 people benefiting, but I'll allow Richard to speak to that. And then
I very quickly, sorry, just to explain, sorry, my question. So the context is colleagues in Uganda are well, this is particularly in Mbale Regional Referral Hospital, so I don't know if they're eligible or if you only want proposals for Kawempe and Hoima, but they have specifically asked for 2 members of staff to do the online distance learning masters in neonatology, which is offered by the University of Southampton, because they want to train them, they want to develop a masters in neonatology for Uganda, and they want to train 2 of their staff to do that, who will then go on to be trainers to train other people and to develop their own local masters. And very unfortunately, in spite of my best negotiating skills, the University of Southampton won't provide this masters for free. and it costs £8,000 per person per year. So that would be achievable within the budget, because it would come to about £16,000, and it would be achievable within 12 months. The question is whether it would be an eligible cost, and obviously it wouldn't be the only thing. There'd be other activities in the partnership, but we would be interested in including that in a partnership. And yeah, and I wonder also whether it's only Hoima and Kawempe, or whether other institutions in Uganda would be eligible to take part in this. Thank you.
Shall I come in, Sheba? Well, firstly, just on the last point, I think other institutions would be eligible, because we've said other regions with high neonatal maternal deaths can still be part of this. I just think we're prioritizing Hoima and Kawempe initially, but from my understanding, we can welcome applications from other institutions. In terms of the masters, but Sheba, do correct me if I'm wrong. In terms of the masters course, I think it's not eligible, unfortunately. I really see the value in it, but I don't think it's eligible because, well, one reason being that earlier I was talking about the budget caps, and we were saying 10% of the budget tops can go to trainer fees. So for me, this would come under trainer fee, training course, for £8,000 or £16,000 for 2, and I feel like that would make it ineligible. I think even beyond the eligibility, I think it would perhaps struggle on the value for money question as well, when put up against other applications. That's not to say then you can't submit it and see what happens, but I think it might struggle against some other applications.
Okay. Thank you very much, Marlene, for that clarification. I think Richard has touched on it. So if you feel Mbale is, you can justify that the Mbale Regional Referral Hospital catchment area also has a high burden of maternal and newborn health. Yes, you can make a case for that. And also, I hear you say you're looking at these two as being trainer of trainers to be able to start up a master's program. But with which university? Don't we already have master's programs within Uganda that are offering this course? So those are the
sorry, it'll be a master's in neonatal nursing. So my understanding is there is no master's in neonatal nursing currently available in Uganda, and the nurses are crying out for training on neonatal care, as you've said in your priorities. So that's my understanding from colleagues in Uganda. There is no master's in neonatal nursing, as far as I understand. I stand to be corrected if you know of one. I'd be very interested to hear about it.
Okay, so I think that's at this stage, I think I can't say would disqualify you. Just encourage you as you write up to make sure you're able to illustrate the value for money, to demonstrate how this is going to build into addressing those priorities and the long-term sustainability. And then we'll view the application with the due merit that it warrants. So at this point, the intent of this webinar is not to say yes or no, or it won't be successful, but it's just to help you shape it. So please, if you feel it fits within those priorities, which I think it does, just work on building a good business case, why this investment needs to be made and how it's going to spill over, and also highlight any benefits that will go back to the NHS as well as the country health system. Then regarding, I think there was another question from you on, for the leadership management, is there a designated partner in Uganda? No, I don't think we have a designated partner. So you'd have to work, you can look around the country and see the people doing this sort of training, a good place to start would be with the Ministry of Health to find out from them and who is taking lead on this leadership management and that curriculum that they want to pilot.
Yeah, so can I just come back very quickly? Yeah, in your presentation, you implied that there was already a specific training course that they have designed and they're looking for people to pilot and evaluate it. Is that correct?
Yes, that's why I'm encouraging you to reach out to the Ministry of Health.
So are you able to provide contact details for the right person at the Ministry of Health? Because obviously I don't know who would be running that course in the Ministry of Health.
Okay, yes, I'm going to put my email in the chat, and then you can always write to me. After this, I'll reach out to the ministry to get the specifics of who should be contacted regarding that. Yeah. And then there was a question also from Beth Word. It mentions nurses, medics, and midwives. Would applications from pharmacist-led MDTs be eligible? Again, those are the priority healthcare workers that we picked up. But again, it depends on the approach. If this pharmacist-led is building capacity of these nurses and midwives and doctors, then maybe it could stand a chance. So the key issue here is to note that we want to improve maternal and newborn health, reduction of the deaths in those groups, and then building leadership of the health managers at the local government level. So if your project is pharmacist-led and is addressing those two priorities, then we would review it and see how it scores against the others. So as overall guidance, whatever you're trying to write up, make sure there is a direct link in addressing those two key priority areas. Muleba, would you want to come in?
All right, yes, thank you, Shiba. So I see that the question for Zambia is the last priority to integrate nutrition and diabetes into the health system, or nutrition and dietetics? So I think here the ministry would like to integrate nutrition and not only diabetes, but all NCDs. We do have training materials that exist, but were developed like decades ago, and there has been no active measures taken to update. NCDs are an emerging issue for us in particular as a country. And so what the ministry would like to do is to ensure that we go back, look at what exists, what's missing, what needs to be developed, and in all that, ensure that the topic, the subjects of NCDs are integrated. So I think that's what the priority is really trying to address.
Thanks very much.
That helps. All right.
Thank you, Muleba. Just going on to Tom's question in the chat then, which was, who are the volunteers in this project and the criteria to select them? So generally speaking, when we refer to volunteers, we're talking about NHS health workers in England who are volunteering their time to take part in this project. Often they do it in their annual leave. Sometimes they're very fortunate to get paid leave to do this kind of work. But we see a lot of people just spend a week of their annual leave to travel to these institutions, or indeed to carry out work online. So that's generally what we mean by volunteers. We are aware that health workers in overseas in Uganda and Zambia will also consider that some of the time they're spending on this project would also be seen as volunteering. I'm being quite specific about NHS volunteers because we need to show the evidence back to the NHS, to NHS England, of this programme, and therefore for the purposes of this programme, when we talk about volunteers, we are talking about NHS volunteers. It's up to the health partnerships to recruit and identify them. There's guidance in our volunteer management toolkit as to how you might like to do that. But it's up to you guys to set the criteria who you want on board on the program. I hope that helps. Should we go over to Paul? You've raised your hand if you want to unmute yourself.
All right, thank you very much for this initiative. I'd like to actually thank a friend of mine who made me get aware of this application form. Thank you very much for taking us through this. I just have a few concerns about this whole application. Maybe to start with, we as primary, I work, maybe just to introduce myself, I'm an obstetrician and gynecologist in Hoima Regional Referral. And I think this application is timely because we, as I forget her name, our coordinator in Uganda, as she mentioned, we really have that very high burden of maternal deaths as well as neonatal or perinatal deaths. So in the past, we've worked with a few partners in the NHS. One to recognize the Basingstoke Hoima partnership. I think it's North Hampshire Hoima Hospital Partnership. These have actually been coming over here to Hoima and have really helped us a lot in improving our maternal and perinatal outcomes. They tend to provide us with a lot of equipment. We actually do work with them in very many aspects, going around regions, improving, providing health talks, and then also improving services in whichever way they can. And just recently, they actually helped us run a campaign back in the UK where they helped us provide monitors. So I think that is a very much needed partnership. But I think maybe moving forward, we can actually use them as our partners if they're already, I think, registered in the NHS as a partnership in Uganda as well. I don't know whether there are other partners. Now, the other confusing thing was the local or the global partnership leader. I don't know whether by that you mean we get partners here like Baylor, CDC. Maybe you'll guide us on that, what you mean by the local partners, Ministry of Health. I don't know. Maybe you'll comment on that. Now, the other thing you need to understand, I feel like much of the problems in the health system here in Uganda, especially with Hoima, might not really be, well, capacity building is one of them. It's really called for and needed. However, you find that the issue is really system problems. Now, with system, I mean, you find that there's human resource, infrastructure problems, and medical equipment problems, which actually, in a way, are the limiting factor. So I don't know whether this we are to include some of these things when it comes to either recruitment, whether the budget will actually account for that, or if we are procuring medical equipment, whether that's also budgeted for in this along the way. The other thing, maybe just to conclude, is maybe how can we access these volunteer toolkits to guide us throughout the whole application process. Thank you.
Thanks so much, Paul. Yeah, really appreciate you being on the call, and thanks for your insights into Hoima there. So, and I'm really glad to hear about the work with Basingstoke as well. That's fantastic. So in terms of what we mean by global partner, sorry, that's not clear. Basically, we mean in this instance the Uganda partner. So probably Hoima would be the lead Uganda partner, the lead global partner, and you would have a UK partner as the co-lead in this partnership. It might be that you have another institution involved in Uganda if you think that's suitable to what you're trying to achieve in your project. But it would probably make most sense for the lead global partner to be Hoima Regional Referral Hospital. So sorry that language is misleading. Then the next question was around aspects of the budget, and yeah, we do appreciate that. Yeah, requests for equipment through these projects comes up a lot. We've said that we will fund reasonable equipment costs. So if you can provide a really solid justification in that application form as to why that needs to be part of this particular grant, then please do. And yeah, the selection panel will review that against value for money. Obviously, the core part of this program is around knowledge transfer between NHS staff and overseas, in this case, Ugandan health workers. So that still needs to be the core part of the project. But if there are some funds spent on equipment to support with that, or that's kind of the key bottleneck that needs to change for the capacity development to happen, then we are happy to consider that. And your third question around the volunteer toolkit, yeah. So I think the link should be in the call document. If it's not, I mean, the place where you can find all our resources are on our website, which I've just typed in there into the chat. So if you go to there, then to our resources section, you'll be able to find the toolkit. I don't know if one of my colleagues can quickly share the actual link in this chat, or I can share it with you afterwards as well. Great, thanks, Paul. And hopefully you've seen Louise's question to you, Paul, if you're able to share your address with her. Please do. Are there any other questions? So Maleba, we've got one question for Zambia. So from Thelma, so for integration of dietetics and NCDs, is the focus on clinical practice or integration into, oh, thank you, Megan. Is the focus on clinical practice or integration into curricula in training institutions?
So basically, the main focus is integration into training. There is a bit that has been shared around clinical practice, but most of the activities are around training, development of curriculum, of modules, of virtual support sessions. Yeah, so if I was to weigh it, I would say 70% training institutions with 30% centering around clinical nutrition support. I hope that helps. Thank you.
Thank you, Maleba. Fab, any final questions? Well, you guys have timed your questions perfectly. It's just come up to the hour, so thank you for doing my job for me. I really appreciate your time on this call. Thank you for your queries. That really helps us as well, and we will put some of those responses to those questions up on the website, so those who weren't able to join the application webinar can see that. So thank you so much for your time. You can find all the details on our website at that address. And as I say, if you do have additional questions, please just email us at grants@thet.org. Maleba and Sheba have also shared their contact details. So if you have specific questions on scoping priorities, you can contact them directly, or yeah, the grants team can just forward your questions through. So thank you. Good luck with the applications. Do let us know if you have any further queries. But otherwise, I look forward to seeing your proposals come through on Friday the 13th. Thank you very much.